Welcome, Mr. Secretary, distinguished guests, and everyone joining us today for the HHS live stream. My name is Beth Daly-Ullum, and I will be serving as your moderator for today's session to convene HHS's Convening to Advance Patient Safety. In a moment, we will hear our opening remarks from Secretary Becerra, who will be followed by Armando Nahum, who will allow us to center our work on the voices of patients and families who have been impacted by harm. It is my privilege to welcome the Secretary of HHS, Secretary Becerra. He is the 25th Secretary of the Department of Health and Human Services and the first Latino to hold the office in the history of the United States. Throughout his career, he has made it his priority to ensure that all Americans have access to the affordable healthcare services they need to survive and thrive, from his early days as a legal advocate representing individuals with mental illness, to his time in Congress and then as Attorney General of the state of California. The Secretary served 12 terms in Congress as a member of the House of Representatives. During his tenure, he was the first Latino to serve as a member of the powerful Committee on Ways and Means. He also served as chairman of his party's caucus, was ranking member of the Ways and Means Subcommittee on Social Security, and the ranking member of the Subcommittee on Health. As Attorney General of the state of California, he took action early in the COVID-19 pandemic to keep Californians safe by using his authority to protect workers from exposure and secure key safeguards for frontline healthcare workers' rights, while taking on people trying to take advantage of others during the pandemic. Born in Sacramento, the Secretary is the son of working-class parents. He was the first in his family to receive a 4-year degree, earning his Bachelor of Arts in Economics from Stanford University. He earned his Juris Doctorate from Stanford Law School. He is married to Dr. Carolina Reyes and is the proud parent of 3 daughters, Clarissa, Olivia, Natalia, and a son-in-law, Ivan. Mr. Secretary.
Beth, thank you very much. Great to see so many people in the audience. I just came from some interviews on COVID. We're trying to get folks vaccinated, and we're letting them know about this updated vaccine, and we've initiated a campaign to keep people safe. And so it's only fitting that I go from there to here, where we're doing everything we can to try to keep people safe. And I simply say to each and every one of you, especially those of you who actually are in the game of patient care, thank you so much for everything you're trying to do. To those who are actually patients or experienced as a family member an incident, thank you for your words. That's going to help us understand better what we can do. I'm going to do something because I can't stay for all the sessions, so I'm going to keep my remarks briefer than what my team told me I had, because I'd like to make sure I can stick around and hear some of the comments. And so for all the team at HHS who I was supposed to introduce, you're going to have a chance to speak or say your name. We got a great team. We're ranked number 2 in all of the federal government when it comes to a place to work, and the only place that beats us out is NASA. And we can't figure out how to send people to Mars yet, but at HHS, if we can do that, I guarantee you we'll be number 1. We're going to do everything we can to make sure we have the best team working on behalf of America. But this is really not for us at HHS to do the talking. It's really for all of you. We want to hear what we can do best. I could announce to you today that the news is out that an airline, American airline carrier crashed today and killed more than 200 people. Now stop, because that didn't happen. But you see the reaction? If I were to tell you that more than 200 people were going to die today from a medical error, you'd say that can't be. But that's exactly what's happening. We're essentially losing an airliner full of Americans pretty much every day from medical errors. But we don't think about it. But is it still the 3rd, 4th leading cause of death in America? But we don't think about it. It's there. It's with us. And the worst part about this is that word error, which means so much of this is avoidable. And so we have work that we can do together to make things a little bit different. I think at HHS, we're ready to take on this cause with you. That's why this National Action Alliance that we are establishing come next year, we believe gives us the best chance to make sure HHS is using all of its tools to work with you most effectively. Because we do believe that not only can we give people a sense that when they walk through the doors of that medical service facility, doctor's office, hospital, urgent care center, that they're going to walk out in better health. That's the goal. And we want to be there to make sure that happens. But to me, the most important thing that comes with addressing this is the peace of mind that Americans can have, that when they're about to send their loved one to what could be the scariest moment in their life so far, that they can count and have confidence that our American healthcare system is going to be there and have their back. And so we owe it to all of you at HHS to do everything we can to help be the glue that makes it all work well. And so we are thrilled to be here with you. I just want to encourage you to believe that we can make a difference. COVID made work harder for us. We're getting back to where we were pre-COVID, but that's not good enough. And so what do we need to do? And we can tell you from HHS and our experience, at least my experience in 16 or 18 months of work, that we can make a difference. When I came into this office back in March, April of 2021, we were seeing within COVID how disparities that are always exist in this country were beginning to show up when it came to COVID. When I started getting reports on COVID, we found that about 2/3 of white American adults had received that first shot of the vaccine. At that point, less than 50% of Black American adults had received their first vaccine, and only around 50% of Latino Americans had received that first vaccine. That's not going to cut it. We can't have people who are being left behind. And so we got to work. But rather than wait for folks to come to the vaccine or come to us, we decided we're going to go to you. And that's what we did. We went to communities that often are left behind. And I'm very proud to tell you that the team at HHS, working with many of you and others in the community who have nothing to do with healthcare but care about their families, we were able to erase those disparities by the beginning of this year, so that 90% of white adults, 90% of Black adults, and 90% of Latino American adults had, along with Asian American, Native American as well, had received at least that one shot. We got to get everybody still now with the updated vaccine, but we're going to make sure that we go to you rather than wait for you to come to us. Same way when it comes to this issue of safety for patients, we're not going to wait till you come to us because something bad happened. We want to go to you. And so please, let's work together because we have a lot of work to do. We can save quite a few lives, but working together, we offer people before anything happens the peace of mind knowing that they can have the confidence to use their medical system and be happy. So thank you all very much. Do I turn it over to anybody or what's the next thing? I think I turned it over.
Thank you, Secretary Becerra. Now honored to invite Armando Nahum of Patients for Patient Safety US, Patient Advocate Group, to the podium.
Good afternoon, everyone. Thank you for having me here today. It's an honor and a privilege. My name is Armando Nahum. I'm a patient safety activist, and I live in Atlanta, Georgia. I am a co-founder of Patients for Patient Safety US, and I'm here and speaking on behalf of that organization. Please allow me to start by telling you how I got here. I belong to that very special club that no one wants to belong to. In 2006, 3 members of my family were impacted by hospital-associated infections and one medical error after another in 3 different hospitals, in 3 different states, in 10 months' time, culminating with the death of my son, Josh. Josh was 26. You know, I can stand here and try to describe you the loss of a child and use such words as intense shock, confusion, disbelief, denial, and anger. Some experts even call it a broken heart. And yet these words don't even come close in describing the actual pain. The resentment and the blame that you feel towards everyone, including yourself, are of immense proportion. And finally, the extreme guilt that you have failed as your child's protector and could have done things differently will most certainly break you, never to be the same again. But today is a different day. Today I have different words. For the past 20 years, there has been a focus on the private-public sector and partnership to move patient safety forward. While we have seen some organizations step up to the plate, our system has not. Our federal government has not enforced its own quality standards. We need to move our country to the point where consequences for not reporting an event or for harming a person is worse than the incentives for staying silent. We believe that patients and families are the component that need to move the work, this particular work, to the next level. CMS Partnership for Patients gave us a brief look into that, only to be taken away by other priorities. Patients and families need to be part of research, guideline development, policy, and regulatory decisions. We have a much different view of care than clinicians. While they see a snapshot, a moment in care of that patient, we see the entire care. Patients and family engagement is the essence of patient-centered care and the most important component to drive harm to zero. Good health is fundamental to the safety and stability of our society. We believe that access to affordable, quality healthcare is a human right for all, no matter one's race, ethnicity, age, social economic status, identity, and any conditions, policies, beliefs, and behaviors which prevent our nation from achieving true health equity are a threat to patient safety and the public health itself. The COVID-19 pandemic has illuminated the dire need for new attention to the issue of health equity, not only in the United States, but globally. Lack of access to quality care, the prevalence of social and racial inequity, the social economic determinants of health, and the shortfall of our health workforce have created barriers to a healthy and productive life for many vulnerable
Recording in progress.
populations. Thank you. In the words of Dr. Martin Luther King, whatever affects one directly affects all indirectly. In closing, Patients for Patient Safety US has two distinct asks. To you, Mr. Secretary, we would like you to consider having our voice at your table by establishing a council at the highest level comprised of patients and family members and healthcare professionals to ensure that patient safety is embedded into every single aspect of our care and coordinated by all federal agencies assembled here today. And equally important, never have this council to be affected by politics, regardless of any administration. And to our healthcare systems, to our leadership and board of directors, we expect to hold yourself and your organization accountable for keeping patient safety as the #1 priority and prevent harm whenever possible. And when that happens, don't hide it, share it so others can learn. We at Patients for Patient Safety US are committed to supporting partners, policies, and protocols which ensure that both health equity and patient safety standards are incorporated across all healthcare, public health, and industry platform for a safer and healthier system for all. Thank you very much.